May is National Trauma Awareness Month. With summer just a couple months away, the statistics for serious injury spike. Let's welcome Adrianna Bellamy, Adult Injury Prevention Coordinator at MUSC Health, and Mary Beth Vassy, MUSC's Pediatric Injury Prevention Coordinator. Ladies, thanks for joining us.
Thanks for having us.
Thank you.
So you say prevention is key. So let's start with you, Adrianna. What do injury prevention coordinators do?
Yeah, so we work to address traumatic injuries from happening in our communities before they happen. And so I work with our adult population, and that is going to be those patients who are 16 and older. And then Mary Beth here, she's our pediatric injury prevention coordinator. So she works with those from birth on to 16. So our mechanisms of injury are a little bit different, but ultimately we want to prevent traumatic injuries in our community from happening to reduce our traumatic injuries seen at our hospitals.
Yeah, Adrianna, so since you're dealing with adults, what are some of the more common adult injuries here in the Lowcountry?
Yeah, absolutely. Falls are our leading mechanism for injury. So we see falls being the reason for a lot of people being seriously hurt. But then car crashes follow behind that as a close second. And then those patients who are injured by gun violence and firearm violence. And so gunshot wounds are our third.
I see. All right. Mary Beth, for children, I imagine that there are somewhat different traumatic injuries. And what would you say are the more common ones here in South Carolina, and especially along the coast?
Yes, absolutely. So we have very similar mechanisms of injury, surprisingly. So our top mechanism of injury is also falls. However, our falls are slightly different than the adult falls. Ours are typically children who fall on playgrounds, who fall while they're running, that sort of thing. That is also closely followed by our motor vehicle accidents. We do see lots of those come in. And then our third leading mechanism of injury is actually burns for children.
Oh, really? Oh, very interesting.
Yes.
And then because summertime, we get out, we're playing, we're having a good time. What about injuries that happen around the water, for instance?
We do have a lot of those, especially for children. We have lots of drowning or near drowning incidences. I'm sure you guys have seen some on the news channels, especially from last summer. And the drownings don't just happen in our lakes or in our ocean and stuff. They actually do happen oftentimes in the ponds and swimming pools that are private. So we really try to address the drowning and try to prevent that, because a lot of times drowning is fatal.
Sure, absolutely. Adrianna, what can we do to mitigate trauma cases as adults, parents, caretakers? And Mary Beth, if you want to weigh in as far as children goes, what are some of the tips and tools that we can use to stop them before they happen?
Well, a lot of the tips and tricks that I like to implement in my programs is just to be aware of your surroundings. Just try not to cut corners when you're doing things in your home. Make sure that you're implementing safety measures in your home. So if you have loose rugs, for instance, or a railing on your stairway that may be a little bit loose, get those taken care of and addressed sooner rather than later. That way they're not a trip hazard. They're not contributing to a potential fall for you or anyone in your family. And then everything else, from car crashes to gunshot wounds, just again, being aware of your surroundings, taking those actions to make sure that you are as safe as possible when you're out and about, and making sure that you're kind of mitigating that risk for yourself where you can.
Okay, and how about for children, Mary Beth?
Yeah, I can echo that. So one of the big things we talk about with children, especially with water safety, but just in general, is supervision, active supervision on children. It's super, super important that we do that, but also for children, modeling the safe behavior. So that goes into putting these things into practice that Adrianna talks about. Modeling safe behavior for children really does make a difference in their understanding and their practice of safety. So if we can model safe behavior, like wearing helmets when we ride bikes, all of that stuff, if we can do that, then children will follow suit.
Yeah, I was a kid that walked into a lot of walls as a child, and my parents would always just tell me, Layla, would you please just watch where you're going? Yes. Well, you have a couple of blood drives that are coming up. Before we get to the details, how do they help trauma victims, these blood drives?
Absolutely. So we have 2 blood drives coming up, and these are really important because we often have trauma patients come in that do need blood transfusions. That is a very common thing in the adult and the pediatric world. And so there's always, if you're aware, there's always a blood shortage. Everybody always needs to donate blood. I think that over half of people are able to donate blood. However, only about 3% do. So that tells you that we really do have a shortage. It's super important. We also know that the Red Cross is really one of our main providers for blood. So as much as we can get to them, the better it helps us out.
Absolutely. Yeah. So you got two coming up. One is on Monday, May 13th at 10 a.m. to 3. That's at the Sean Jenkins Children's Hospital. The next one's Wednesday, May 15th. And that is at the MUSC Main Hospital Horseshoe. Ladies, I want to thank you so much for joining us today.
Thank you.
Stay safe out there, everybody. Watch where you're going. We'll be back after this.